Welcome everybody to the first of what will be a three-part series e-discussion hosted by the Asia chapter of the International Association for Political Science Students, or what we all call IAPS. My name is Rose Smith and I am the Vice President for Regional Affairs of IAPS, and I am absolutely enthusiastic to be moderating the discussion today, as this is the first project or event of IAPS Asia. I would like to welcome both members of IAPS as well as IPSA, the International Political Science Association. On that note, we would like to thank IPSA for also always supporting IAPS, and in particular for sharing this event to their members. We are absolutely happy to not only have IAPS members, but also IPSA members among us. We do have quite a diverse audience, as I mentioned earlier today, coming from various countries, both inside and outside Asia. We have people from Canada, China, France, India, Indonesia, Italy, Japan, Kenya, Morocco, Nigeria, Serbia, Spain, Switzerland, the United Arab Emirates, the United Kingdom, and the United States of America. So not only Asians are interested in Asia, but the rest of the world as well. 15 of our audience members in particular are from China, so I think that they would be quite interesting. They would provide an interesting perspective as well in the discussion. Moreover, our audience ranges not only bachelor's and master's students, but also doctoral and postdoctoral researchers. So such diversity will prove to result in some fruitful discussions in our question and answer portion at the end of the event. The Asia chapter envisions these discussions as a way for students and enthusiasts of politics to listen to both seasoned scholars that we have here, as well as up-and-coming junior scholars for their views on some of the most pressing matters of the issue. This particular episode will be exploring Asia under COVID-19 today and tomorrow. Our goal is to shed some light on key concerns relevant to the society and politics of Asia, which are currently being shaped by the global pandemic. I am delighted to be joined by two wonderful experts in the region, and I would like to thank them so much for accepting our invitation and spending an hour and a half sharing their knowledge with us. First, we have Dr. Madhumati Deshpande, an Assistant Professor of International Studies and History at Christ University. Dr. Deshpande has very recently written on sports diplomacy, international relations, as well as foreign policy in the US and West Asian states. Dr. Deshpande, thank you so much for joining us.
Thank you. Thank you for the invitation. Thanks.
I am also pleased to be joined today by Dr. Kamran Bokhari, the Director of Analytical Development at the Center for Global Policy. Dr. Bokhari is also a National Security and Foreign Policy Specialist at the University of Ottawa's Professional Development Institute. He has also served as the Central Asia Studies Course Coordinator at the U.S. Department of State's Foreign Service Institute. Dr. Bokhari, thank you for joining us today.
My pleasure. Thank you for having me.
Perfect. We will also be reeling in a junior scholar in the last three questions of our discussion. Ms. Chu Sha-se is a diplomatic studies student at Wuhan University in China, and we are absolutely excited to have her here and listen to her perspective as a bachelor student in China. Welcome, Ms. Se. I think she's here. I did see her. Before we begin, and I know everybody's excited to just delve into the discussion, I do have to run through a bit of housekeeping as per usual. First, please note that this event today is on record. A video recording of the discussion will be published in the IAPS YouTube channel. We would also be grateful if you could follow us not only on YouTube, but also Facebook, Twitter, and Instagram, because social media is now a huge thing in our lives. The link will be provided to you on the chat function of our platform. The discussion will be followed by a question and answer portion. Should any questions arise during the discussion with our experts and junior scholar, please feel free to type them in on the chat function. Please indicate in your question to whom you would like to address it. You may also include your name and country or institution if you are comfortable. All right, so let's jump right in with the first question of this discussion. Dr. Deshpande and Dr. Bokhari, we have already observed the global pandemic and its effects for a couple of months now. Its implications have definitely highlighted the interconnectedness of global movements as well as global politics and economy. Based on some initial observations of the past months, how do you think has this pandemic shaped the global political order, and where do you think Asia stands in this? Well, this is quite a huge question to ask. We'd appreciate it if you could give us an overview of your thoughts. Dr. Bokhari, would you like to start?
Sure. Thank you again, Rose, for organizing this and having me. Um, so I'm going to divide my response into two sections. So one has to do with the pandemic itself, and then its implications. The pandemic is something that we've not seen, at least in our lives. Anyone who is alive today on planet Earth has no recollection, no memory of a similar situation where global life has been disrupted. Global commerce, business as usual, children going to schools, people going to work, the supply chain of goods and services, pretty much everything has been disrupted. And there's going to be a massive, and we're already seeing that, economic financial fallout from the pandemic. There's a sort of a psychological aspect to it, is that even if the governments, and I can say from where I am, I live just outside Washington, D.C. in Virginia, and I know that our lockdown is going to be eased. There are 3 phases to it. This is the first phase where there's going to be an easing of the lockdown. Already we see a lot of people, out and about. But there are a lot of people who just won't do certain things, not because, of some actual problem or actual threat to their medical health, but because they're not sure. And so, for example, things we took for granted, eating in restaurants, going to movie theaters, that kind of stuff, I think will take a while before we can, limp back to normalcy. People, say, okay, there are divergent views coming into the media and the open sources. What do I really believe in? And it depends on, who you're listening to and who's your preferred media outlet. And that's how you're going to decide what you're going to do. There are people who are eager to go back to work. There are people who want to re-socialize, but then again, there's ambivalence. So there is that aspect. And then of course, the idea is, is this over, or are we in the clear, or is this just the beginning? There are, again, divergent views among experts, and the general public does not know what to do. Then of course, there are different authorities in any given country. There is the national government, the government at the regional level, and then of course the municipal level, and they're not all on the same page. So from a point of view of an average individual looking to the authorities for guidance, there's quite a bit of confusion. And so it's taking it one step at a time. So there's that pandemic aspect. I'll quickly go over sort of the geopolitical implications. Obviously, the economies are being hurt because of this is, in many ways, this isn't like a normal economic downturn. This is what I would call a downturn forced upon us, where it's not that one sector of the economy in any given country or part of the world is suffering due to the usual recessionary cycles. This is a shutdown of everything that was possible. Travel, we know that Uber, the global cab service, it has really suffered big time. Brand name institutions are filing for bankruptcy. So at a geopolitical level, states are weakening, and it depends on who you are. If you're the United States, you have significant bandwidth to weather this. Likewise for the European countries. China has, a big, insulation level, layer of insulation that it can, absorb the pain and the shock. But there are countries in the world that don't have that kind of a situation. So even if the death toll in a given country remains low, we don't have the figures yet. We don't have the numbers yet to sort of say just how hard COVID-19 has hit countries politically and economically, and of course then socially. I was writing a piece on what's happening in Central Asia to the five stands, and I couldn't help but realize that yes, there is the risk of political fallout, uncertainty, instability, unrest, but also this is an opportunity for development as well at the same time. I mean, if your country gets development funds and you use them wisely, I mean, this could attract capital as well, because investors are also, their day-to-day functions of figuring out where best to put their capital has been affected. So they're also scratching their head and saying, where do we put our money? What's the biggest bang for our buck? And so I think that no matter how you slice it, the world moving forward will be very, very different. And I don't think anybody has an idea, because we don't know if there's going to be a second wave. Here in the United States, we're worried about November because of the cold, the colder weather setting in, and maybe a rebound of the virus. And things are really unclear. So geopolitically, we don't know. There are certain things that are not going to change. And again, it depends how strong of a country we're talking about. But then there are a lot of other things that will change, and we just don't know in which direction. I'll stop right there.
All right. Thank you, Dr. Bokhari. I really appreciate it that you've also identified opportunities for countries that don't exactly have this savings or something they could fall back into. So I guess it's time to hear from the thoughts of Dr. Deshpande on the global political order and where you think Asia would stand in this.
I think she's muted.
Okay, can you hear me now? Yes. I was not allowed to unmute myself yet. So anyways, okay. So thank you, Mr. Kamran Bokhari, for that overview of the pandemic and where the different countries stand and what happens now. I'm not going to touch that part at all. I'm just going to add on to what you have already said. There have been a lot of discussions on how this is going to affect globalization, how this is going to affect different countries in the world and their governments, their administrations, their national interests, and the worry about, especially in Asia, about China rising and China taking over and Chinese expansionist ideas. All of these are again, scholars are still debating, and we don't know where to place all of these events that are happening in the world, because again, as Mr. Bokhari pointed out, there is no precedence as to what we can go back to or how we can look at this event and say, okay, this had happened before and this is how everybody reacted, and now we go back to that, and maybe changes will happen, but this has happened before. That precedence is not there. So that brings us to the question, what is really going to happen? And looking at what has happened so far, we can easily predict that certain things are going to emerge out of this pandemic. And it is not going to be the same world that we are going to go back into post all of the unlocking that is going to happen all around the world. We started our unlocking in India, from tomorrow onwards, but people still don't know what is allowed and what is not allowed and what we are going to do, and whether, and even if there is clarity from the administration, people may not have that kind of courage to do it, even if the authorities allow you. You are always hesitating whether to do something or not do something. And that brings the whole, globalization. We were globalizing into question because before the pandemic happened, everybody was a world citizen. Everybody wanted to travel around the world. Everybody wanted to have businesses around the world. It was exploding. It was, there was no match to it. Everybody had these high ideas about how I'm going to have businesses all across the world. And that is being hit so badly now that everybody now has to start thinking about inwards. Everybody has to start thinking about, how do I make it, yes, I have to make money, but how do I make it within my own country? Maybe I'm not able to expand outside right now, but when, if, and when I can, how do I make it further? As Mr. Bokhari was pointing out, the supply chains. Earlier, it was the supply of the goods, the made goods going back to those countries and getting sold. And now it is both the ways it is being shut, whether they are going to get the resources, whether they are going to get the orders, or whether they are going to get the goods out of their own country to the markets that they need to go to. We don't know how they are going to accept the markets are going to accept the goods that are being sold. So everywhere that has been hit, and that's the worry that people have. But for me, I'm still positive about globalization. I'm still positive about, again, my opinion, and some others also agree with it, that it can't stop. People know what it is like to go beyond their borders, to go have that business outside and have the kind of wealth that they had accumulated, or have the kind of experiences that they have had. So even if it stops for a short period of time, it is not going to be completely stopped. So once we are out of this, and then that will happen is, of course, the first thing is to be the vaccine. And whether that vaccine is going to stop all of this is not, that's the first one. And a proper, recovery path for everybody who gets infected by the COVID-19 infection. So if you do get infection, you don't really have to worry, because you know that there is a cure for it, and that it will become like any other infection that you have. So once you have that confidence that even if you get infected, you will get better, people are going to move out of this. Because I can see around here, just in our town, people are itching to get out. They don't want to be confined anymore, because they know that there is a huge world outside. They know that it's great to be outdoors. It's great to be out of the country. It's great to be out to do whatever you are planning to do. And they are being confined, and they have itching to get out. So it is not going to, so globalization is not going to stop. It may have stopped for a short period of time. It is not going to stop forever. So there is a positive outlook in saying that, yes, it may happen. So there are many people planning on how to unlock themselves and get out of that area. But there is also the other part wherein, and this people have noticed, I mean, younger students, especially the students that I have spoken to, have noticed, those who were supporting capitalism immensely before are now saying, no, government has to do certain things. So maybe a combination of it's maybe a welfare society is what we are looking for. Earlier, the ones who supported capitalism are moving towards more government intervention. And that is something that I think we have another question that addresses it. But that is something that where the global order is also moving towards, that it is not going to be completely individualistic. There is going to be more government intervention in many of the areas which they had neglected before, or had thought that they would have overcome with the huge developmental, the huge developments that were happening in the country, that capitalism will take care of this, the businesses will take care of this, the demand and supply will take care of this. Government need not worry about it. But they have to look back on it now and say, okay, government, maybe they do have to look back, because not everything is taken care of by the demand supply. So those are the few points that I wanted to add on to this.
All right, thank you so much. I'm sure that these are really great foods for thought, and a great start, definitely, of this discussion. I personally am quite thrilled to hear all these new ideas, and I would definitely want to expand them. But of course, we are limited with time, and as usual, we only have 24 hours a day. But I really love how both of our experts have touched upon uncertainty and also balancing priorities within the government. How do we cope with this sort of uncertainty if we don't know what's going to happen, or how we're going to solve it? So definitely, these are unprecedented times. And what Dr. Bokhari mentioned, the people who probably experienced a similar sort of global pandemic probably don't have any recollection of it at the moment. So I'm absolutely sure that we have heard this over 100 times now, that we are living in unprecedented times. And it does go without saying that almost all facets of our lives, as mentioned by our experts, social to political, are being challenged, and it's quite challenging to just stay at home, quite shockingly. And most of these come from policies that our national governments have implemented. And I think this leads us to our next question, which is, how do you view or assess the response by political leaders in Asia to COVID-19? Considering that our government, I'm sure when they were elected, they did not expect to have such a big issue to be put on their plate. So maybe we could start this time with Dr. Deshpande. How do you think did government leaders, did politicians handle the situation in COVID?
Okay, Asia is too huge to really start answering that question, but I'm going to stay closer home because whatever else I have read is, of course, I've read about it, I've really not studied so much. So the response, yes, as you said, has been varied in Asia. Of course, I'm not really talking about China initially. I don't want to touch on China. I want to talk about other countries and then come back to China. So in closer home in India, initially it was, it may not come and it may not, it may not affect us as much, even though China is our next door neighbor. It may not affect us. When it didn't really affect, it went off to Europe. It was, maybe we are immune. Maybe we have all of these immunities and vaccines we have taken before. There are so many other things that came up that maybe we are immune. What I felt at that point of time was maybe we don't have as many visitors coming from China to actually bring that infection back into India. And maybe that's why it took a little longer for us to get the virus, because even though we are right next door, I mean, there is not that much of a people-to-people contact between India and China to spread the virus as fast. So maybe it did take that long. This is again a speculation, and how did it come in again is a speculation. So initially, even the government of India didn't really worry about it initially in February. We can say in February, we were not really worried. But by March, we started to get worried about what is happening and how many patients were coming in, how it was increasing around the world. So immediate reaction that government did was to shut everything down, close down international borders, close down travel within India, so that people who have it will not give it to anybody else. And initially it was all about international travel. Those who are coming from outside are the ones who are bringing it in. So you shut off the international border, so maybe it won't come in. But what about those who had already traveled in December and January and had already come into India? That's what they realized afterward, that it's not people who came in February, it was the people who had gone in January and even in December that had traveled back in time, back in December and January, that had brought the virus back into India. So how would you deal with that? You will have to deal with that within the lockdown that happens within India itself. So initial reaction was shut everything down and nothing works. And that policy, I have been a critique of that policy because it was not well thought out. When you shut everything down, what happens to everybody who doesn't have a house to live in, doesn't have the daily savings to daily feed yourself every day? What happens to those people? That part was not thought about. It was, yes, the right action to lock everything down so the spread may reduce, but it was not a well thought out plan to actually shut everything down. And similar thing happened, I think, even in Pakistan, even in Bangladesh, that yes, shutting it off may have been a good idea, but what did you do about the rest of the country, the people who couldn't really feed themselves every day, who didn't have a house to live in? So what happens to those people? That was not a well thought out plan. But the whole shutdown also now is questioned because the cases are going to rise once the shutdown opens. Right now, what is happening in India is that it is going to rise. So during that period of shutdown, what did you do? Did we take care of all of the health issues, health infrastructure that needs to be put in? When the lockdown ends, then you can go back to that. When the lockdown ends, you know that it is going to spread. So did we prepare ourselves for it? Which hasn't happened, which is the problem now that we are now facing. And because every expert now is saying June and July are the time when the figures are going to rise, when the numbers are going to rise because everybody is coming out. So it is going to affect more people. So do we have the hospital beds? Do we have the test kits? Do we have laboratories that could test you immediately so you get the results? Do we have all that preparation in place? If that was the case, then we could probably address this easily. But if that is not in place, then we are back to February or March. There is no change that has happened. So shutdown or no shutdown, it is going to be the same. And that's the problem with the shutdown is that the economy has been hit. So people are now going to ask you to open up the economy. Without opening the lockdown, you can't open the economy. So you're caught in a situation where you have to do something about the economy, but you don't have the infrastructure yet. So that has been a problem in India. And I see the same problem happening in Pakistan as well. I think the Supreme Court today told the government in Pakistan to open up the economy because people cannot live under lockdown forever. So now the Supreme Court is stepping in to tell the government, yes, it needs to be opened up. And of course, Sri Lanka is not as badly hit as India or Pakistan is, but Sri Lanka also cannot afford a complete lockdown. So these are the countries where it has worked. The lockdown has worked in Asia, I think, is Japan. Japan didn't lock down completely, but South Korea did. And South Korea, why it worked is they put in place a health infrastructure that could help the people. And that's where South Korean lockdown has been effective. But it can't be transferred to other countries in Asia because the kind of infrastructure that they had and the kind that we have in India are not the same. The population is completely different. The movement of people is completely different. So you can't really compare the two. But it has worked in South Korea, but not so much in India. And that's how I think that's what I would like to listen to Ms. Bokhari as well on these points.
Thank you, Dr. Deshpande. I think that was a quite really wonderful overview of what's happening in India and a little bit of Pakistan, Sri Lanka, and as well as South Korea. Dr. Bokhari, we'd like to hear your thoughts definitely on how you think that the governments have dealt with COVID in Asia.
Well, I think that Dr. Deshpande has, done a wonderful job of sort of laying out the strategic situation. I would add by saying, look, the way to understand this is to look at it through empathetic analysis. You need to look at what a government, not what a government necessarily did or did not do, but what can they do? Because all states are constrained. And again, this is a situation that nobody was really prepared for. Mind you that, many economies in Asia, particularly those that are struggling, are those that have been, even before the pandemic, they were struggling to make ends meet, Pakistan being one of them. Now, on top of that, you have this added strain of shutdown leading to almost a halting or extremely low levels of economic activity, and therefore you had a situation of what can be done, and there is no blueprint as to okay, this is this isn't like you go to a doctor and say, okay, I've been sneezing and coughing and therefore the doctor will say, okay, you may have caught the flu. This is a completely unprecedented situation where you don't have a blueprint on how governments should react. What can they do? Like if if the economy is overheating, you tend to engage in fiscal and monetary policies that will slow it down and not lead to an overheating of the economy. Likewise, if the economy is contracting, then you drop interest rates so that you can re-stimulate economic activity. But this is none of that. And so my own view is that while we need to hold governments accountable for what they are doing and in terms of their performance, we also need to be mindful that they don't really have like a master plan to go back to. They're as sort of caught off guard as anybody else. And then, of course, we can talk about competencies and weaknesses that predate COVID. So I think that overall context of how we look at things need to not just look at the output, the actual performance, but what are those constraints and imperatives that any state needs to pursue. And in that light, you'll notice that if we go about our business and say, okay, you know what, I'm just going to engage in a partial lockdown. Let's just kind of rewind the tape here and say, okay, it's February again, and if you had to do it all over again, what are you going to do if you're a government, say in India or Pakistan or Bangladesh or China or Japan or South Korea or any one of those in Southeast Asia, or even in the Middle East? Iran was hit very hard, and so first of all, it takes time for machineries such as big as governments to sort of first figure out what's really going on. There's so many power centers that need to negotiate with each other. In democratic societies, there's a bit more, if you will, set mechanisms and ways and pathways for decision making. But there are a lot of countries that are not democratic or are partially democratic, and there are, I would call them sort of irrational centers of power that have no sort of rhyme or rhythm to them, but they're there because that's the way that the states evolved into what they are today. And they all have to be taken on board, and they all disagree and don't even know, and in some cases, in a situation like COVID-19, it's kind of like passing the buck and looking at the other person in the room. Imagine yourself sitting in a meeting of a National Security Council, say in Iran, and I'm pretty sure if I was a fly on that wall, I'd come. I'm pretty sure that everybody would be looking at each other for answers. Okay, so what do? Do we shut down the entire government? The society, and then what? And so yes, in the beginning it was, save as many lives as possible, and if you do that, that is the way to go about. But as Dr. Deshpande mentioned, that the whole thing wasn't thought out that well, where, okay, what is going to happen to the day laborers, the wage laborers that rely on daily wages to meet the needs, the economic needs, financial needs of their loved ones? So that wasn't factored in. But I would say that in a moment of chaos, in a moment where you're looking at, think about, how the world sort of operates. There are a lot of, it's sort of very top down. You look in a situation where you have a global crisis, you're looking at great powers in terms of what are they doing. And you're looking at, the international community, international institutions. If you're a poor country, you're looking for, help and assistance from guidance from institutions like the World Bank Group or the International Monetary Fund. And in the case of Asia, the Asian Development Bank. And you say, okay, how can they help me? What is the United States doing? What are the Europeans doing? What are the more wealthier nations of the world doing? What is Russia doing? How have the Chinese dealt with the situation in Wuhan? And then, of course, information. Are you getting the most reliable information? When you're talking about information, you basically, at the level of a state, you're basically looking at intelligence services. What are your intelligence services telling you about what's happening in another country? And then, of course, we live in an era of fake news and information operations. These are some of the gifts of globalization and the advancement of technology. Is you can't really know for sure what's happening. You have to sort of read between you read the tea leaves or read between the lines of what you're reading or hearing. And so I think that the governments are a collection of human beings, and human beings aren't perfect, and they're always looking for answers to optimize their whatever decision making that they're engaged in. So in this case, the idea was, okay, a lot of people are going to potentially die, and nobody knew much in the beginning. So there were obviously natural mistakes are made. You don't know if how contagious this is. How is it being transmitted? It took several weeks for people to figure it out. We need masks. Pre-COVID, okay, masks, nurses wear them, doctors wear them, certain amount of, hazard workers who engage with hazardous material, they wear them, but it wasn't something that people would wear at least not in the entire world. Of course, we've had avian flu and SARS and all of that. So there was some, low level of practice in society of people wearing masks, and that too, not all the time. There was no stay at home, okay, stay at home. What does that mean? Do I go to work? Am I still going to get paid? Okay, well, how will this affect the supply chains that are bringing produce to shopping centers from where people can go in? There was a rush to, I know even in the United States, we ran out of, items like hand sanitizers and toilet paper and all those things that we take for granted, that we always knew that, okay, you know what, whenever I need them, I can just go to the supermarket and pick them up because they're going to be there. But they were not, but they all of a sudden they ran out because people started hoarding. So what I'm trying to say here is that decision making is very, very difficult. It's not possible to know. I mean, I think that I think Dr. Deshpande mentioned, or it was yourself who said earlier, that when governments get elected, this isn't what they were signing up for. They were signing up for something completely different. They were signing up for business as usual problems. Okay, the economy is not doing well. Oh, I have, a security situation in X area in my country. Exports are down, or, I need to do something about reducing my, energy import bill because I'm not really a producer of energy, natural gas or crude oil. And therefore, those are the things that politicians and political leaders had in mind in terms of, okay, this is what I'm going to be doing because I'm elected. I mean, let me take for the example of India. Prime Minister Narendra Modi did not think, when he took office again in 2019, that this is what he's going to be doing for a long time to come. This is going to consume his second term as prime minister. He thought, okay, there are tensions with Pakistan. I need to deal with great powers. I need to make sure that, the promises that I have pledged and I've criticized the Congress party for a long time, and I need to deliver on those promises. All of a sudden, all those plans, you're forced to set aside because you have another situation that came out of left field. So I think that it's very important that we engage in empathetic analysis when we look at how governments have responded, continue to respond. There's still a lot of unanswered questions. So I think it's the decision-making process will continue to ebb and flow depending on what kind of information comes about. Vaccines right now, that's the big issue. When are we going to have a vaccine? It is going to take a year. Is it safe? What is the testing? Then you have competing voices with different companies claiming different things. You pick up, nowadays we're not living in the physical newspaper world. We're living in a world where we're glued to our phones and computers and tablets, and they're providing us, 24/7 information that's changing by the minute, literally. If you're on Twitter, and you follow, let's say you follow 1,000 people, you're literally every second you're getting more information, and that's really reshaping, and it needs to be processed before it can reshape your thinking. And so I think that we need to be mindful that this is a moving target.
Yeah. Yeah, thank you, Dr. Bokhari. I think that you've definitely laid out a good framework and a bit more nuanced framework as what most of us, I think, would approach studying this particular pandemic, which is what are the governments doing and now you presented as what can these particular governments do. And I think that it does touch upon a little bit of the inequality, the greater inequality that certain societies in Asia already have even before the pandemic. And this has somehow either exacerbated these particular inequalities when the pandemic has come and hit the countries. So in the following questions, we will be welcoming our junior scholar, Ms. Se, in the discussion. And I am personally looking forward to hearing valuable insights that she would add into this particular discussion. And we did talk about social structures and how the pandemic has impacted them. And I think that both of our experts here have touched upon inequalities. And I think that we would like to stress this particular point particularly. Are we witnessing greater inequality as a result of the pandemic? And are we prepared to handle the consequences? Now, Dr. Bokhari already sort of answered this a little bit. So I think that we could hear from Ms. Se. What do you think? Are we witnessing greater inequality as a result of the pandemic, and are we prepared to handle the consequences of this?
Hello, everyone. Thanks for inviting me to this e-passion, and I owe thanks for everyone's concern to Wuhan. And now I will briefly introduce the situation in Wuhan since the outbreak of the COVID-19. On December 31st, when the news reports that a kind of suspected SARS virus was spreading in Wuhan, many college students, including me, were hurried to buy medical masks and avoided to go to the public places as much as possible. However, according to our observation, many citizens in Wuhan, they did not take it seriously at that time. And then I left Wuhan on January 10, but I was still worried about my teachers and classmates who live in Wuhan. And during the Spring Festival in China, the virus spread so quickly, and the people of Wuhan have had a hard time. Of course, hospitals are struggling for medical supplies, and doctors were overworked. And people, they couldn't go outdoors. And the local community bought basic necessities for every family. It was when the Chinese government built 2 new hospitals and sent doctors from other provinces to help Wuhan that the situation began to get better. And let's come back to the question, how is this pandemic impacting the social structures in China? In my perspective, the biggest impact by the epidemic on the social structure of China is that more social self-organizations have been established, and they have improved their capacity to support people in Wuhan. Let's look at an example. Wuhan issued policy on city lockdown on January 23rd. All the public transports were suspended. It caused that some doctors and nurses who are not from respiratory department or fever clinic need to work more than 12 kilometers home. Therefore, one man called Chen Shujie and his friends decided to help these medical personnel by organizing a public service fleet. They started by collecting private cars drivers in WeChat's friend circle. On January 23rd, more than 400 people were recruited. And after 2 days, the WeChat group, including the doctors, the nurses, and the volunteers, numbered nearly 10,000. And they did not do any publicity in the whole process. Everyone just spontaneously posted the message in their WeChat friend circle. And many people offered to do the group management work at that time. And there was at least one administration in each WeChat group, and they helped to upload and send messages, especially tips for safety, as well as some emergency feedbacks. The public service fleet has also developed a management manual on how to protect the drivers themselves. And we can see that there were many self-organizations like that. They deliver medical supplies and food to the doctors in the hospital. And this social self-organization had a common goal, which is provide support for the medical workers in Wuhan. And there were also simple rules of behavior, and there is no central control involvement. As we can see, Chinese society has shown some resilience in the face of epidemic. And during the epidemic, we saw a great development of self-organization, but there were other signs of greater inequity in China. As the virus has turned online conveniences into daily necessities, those people who are live in China's rural hinterland have been cut off from their regular lives, especially when it comes to education. Chinese official demand was that stop classes, but don't stop learning. So children in rural areas may face difficulties in 3 aspects. First of all, their families cannot afford the smartphones. And secondly, the network signal in rural areas is very bad. And thirdly, children's schooling screech to a halt when their parents go out to work in other provinces. All these have a negative impact on rural left behind children's education. And we can see that the coronavirus fights release education digital divide in China. And to solve this problem, China's government started all-day TV broadcasts of lessons in math, English, arts, and even physical education. In addition, for university students, our university subsidized each of us 100 yuan for the phone bill. And at the same time, some volunteer organizations actively gave psychological counseling to some poor students. Therefore, facing the inequality caused by the epidemic, we can overcome the difficulty through the cooperation of the governments and self-organizations. Thanks for having me.
Thank you, Ms. Se. I think that was a very great summary of how the situation is on the ground in China. And I'd like to take this opportunity as moderator to actually ask our experts what their thoughts are about citizen empowerment. Ms. Se has mentioned how the society within China has sort of worked together in order to help their medical workers. And currently I am also here in the Czech Republic. And there are quite a lot of citizen empowerment movements here wherein households have created masks for people and they started giving it to them for free. So I'd like to know what Dr. Bokhari and Dr. Deshpande's ideas are on how citizen empowerment has developed during the pandemic. Maybe we could start with Dr. Bokhari.
Yes, if you notice, when governments are sort of caught in a situation where their resources are stretched and governments are scratching their heads and looking around and saying, okay, how do we deal with this emergency situation? It is natural for members of civil society to say, well, I can't rely on the government because the government's resources are stretched. And therefore, civil society groups kick into higher gear. And this isn't just for COVID-19. You look at any calamity that has occurred in the last several decades in any part of the world, you do see civil society organizations coming together. And of course, the idea of volunteers working with civil society organizations or even helping governments, and of course it's different in different places, but this is a natural sort of tendency because people need help, things need to be addressed, and it's going to be a while before the government gets to you. One of the biggest reasons for the lockdown was obviously the need to save lives. But at the same time, there was a fear that if the lockdown did not occur, that the healthcare systems in a country would be overwhelmed, because if the disease spreads, then what do you do in terms of dealing with it? So many people are showing up at clinics and hospitals and they're falling ill. Then how will the national health system be able to absorb that volume of sick people? So the governments are already, if you will, under stress and strain, and this provides for an opportunity, excuse me, for an opportunity for individuals who can, and not everybody can, because a majority of people are worried about their daily lives. They don't really have the bandwidth, financial or even from a time point of view, to come out and volunteer, but many do. And the more organized they are, they do. And you rightfully mentioned, masks, if you will, I know that even in the United States, you had people who, it wasn't their job to create masks, but they went out and did it. and said, okay, let me sort of help out here. And a lot of these people just gave them away for free because it was a need to do. And I think that when a situation like COVID-19 happens, that's when you go beyond sort of what the government can do and cannot do. Obviously, governments will suspend business as usual. And this is where I'd like to reconnect with a point that you made earlier, or actually it was Dr. Deshpande that made that point, is that we're now looking at, political economic philosophies and saying, okay, does, democratic capitalism or capitalism in some shape or form where the state isn't involved in providing those services and it's left to supply and demand and the private sector, those are going to be revised. I would add to that, and I would say a lot of what we're seeing right now, especially in healthcare, is our emergency measures. I don't think any state has the ability to ad infinitum indefinitely, unless you're like a Canada or a European state or one of the other countries in Asia that provides for socialized healthcare, and it's a national healthcare system where you don't have to pay for services. That's separate. But if there is a stimulus being offered, I think it's an emergency measure, and we shouldn't sort of take this for granted. And states will have to go back and rationalize, because at the end of the day, who will pay for it? That's where civil society comes in. And I think that the volunteerism and how citizens around the world are dealing with these situations is going to be playing a vital role, even in normal times. Governments have only so much capacity. Even in normal times, although the word normal now, appears strange. What does it really mean to be normal? But I'll use it anyway because I have no other better word to use. In normal times, not everything is being done by the government, and it's natural tendency for citizens to get involved. So, for example, and this is more so in countries that have more frequent elections like India, or even in the United States. It's not run by, elections are not run by governments. They're volunteers that come in, whether you're politically motivated, whether you're motivated because, you're part of sort of it's your civic sense that wants you to get involved. That same impetus, if you will, pushes people to get involved and do things and help people out, and make sure that things are running smoothly. Because I think at the end of the day, governments tend to become distant, if you will. So if you live in a town, X town, and it's not one of the major urban areas, or even if it is the major urban area, you're not always thinking about the head of government, or even the regional government, or even the local government. You do need to be able to do certain things yourself. And I think in a time of COVID-19, this, if you will, dynamic has been accentuated because of the sheer stretching of state bandwidth. And so I think that there's a role, there needs to be more organization, and things aren't always neat and clean, they're messy, because this is the nature of the crisis that we're in worldwide. And every society will sort of figure things out as they go along in terms of, how much can the government do, and where does the citizens' role come in? And I think that citizens will get more organized, and say, okay, do I need to, like, for example, people with spare money, they're looking, at a situation, they're hearing the news that, people are suffering in an X area. There's a tendency to at least give, to donate. And so, okay, say, I'll give, so much money to this cause. It doesn't matter what cause it is, but you do give. That's sort of the very basic way in which citizens get involved. Plus, then there's active volunteerism. And again, it'll vary. If the more robust middle class you have, and civil society is robust, you see more participation by the common person, that doesn't have any government position.
Thank you, Dr. Bokhari. And now we'd like to hear from Dr. Deshpande. And I'd like to point out that Dr. Deshpande did mention before that some of her students who were more capitalistic leaning has realized the importance of stronger governments. And now I feel like we have two sort of opposing ideas here. Some people would like a stronger government, and some people seem to have like a stronger sway towards having a stronger civil society. So I'd really like to hear Dr. Deshpande's thoughts about these two sort of different ideas.
Yes, the civil society, yes. I mean, every day in the newspaper you read about, especially here in India, you read about this rich person made sure that they donated so much money. This rich person sent a plane full of migrants home. That person helped in bringing food to the migrants, made sure that they reached their homes. Every day, I mean, there are individual donations, individual initiatives that are coming up from the civil society to help the people who are desperately in need of that help. And there are also civil society organizations that have taken it up on a huge level and are making food packets, making masks, making health packets for the nurses, for the people in the health sector who are working day in and out. They're helping those people. So there are a huge number of civil society groups that are coming in. Of course, it helps that you're at home and you can see other people struggling. You can put together, and of course now the technology helps with such kind of meetings. You are putting together things that that could not have been done probably if we were not staying at home and not watching outside, not observant enough. So in a way, lockdown helped us bringing together people as well. So that has, I mean, that has happened here in India. And there is also another factor to this civil society coming together is because in many cases, the trust between the government and the people is not that strong, especially the trust in the healthcare sector. So I know of examples and individuals who are stepping out to actually help the government in tracking and tracing the contacts of a COVID patient. These are regular people who are helping them. Of course, there are doctors and other people who are helping, but there are people who volunteer to get into these areas and to help in contact tracing. And these are initiatives that people have taken up because they know that government will not be able to handle this. They cannot do this. Yes, they are overstretched. Either they are overstretched or that they don't trust that everybody will do it well. So they step in to do that for the government, and they're helping out, which is great, which needs to continue even afterwards. I mean, the interaction between the government and the people has to continue even after COVID, and that's what actually the civic engagement is. What every political scientist dreams of, because the more people are engaged, the better it is for the democracy, and we do look forward to something of that nature. Not, of course, just not just in emergencies. So on one hand, people's participation has increased, but at the same time, everybody now wants a strong government because everybody looks up to the government to take these policy decisions. So are we going to now, I mean, this is something maybe controversial if I say it, are we going to now punish China for starting this, this pandemic? Are we going to punish them? Who are we going to punish? This has happened in the US. This is happening in India. When there are social media is flooded with the messages saying, let's stop buying everything from China. They're our enemy number one now. So these are things that make that frenzy that comes from the people, that you have a common enemy, and now you look towards your government to save you from that enemy. And that makes the government, of course, take into this in public opinion and say, okay, yes, maybe we have to do something about this. Especially here in India and Pakistan and Nepal and all of these areas. These are the places where people want the government to take an action. And there is a small border issue that has happened between India and Nepal recently, which is again bringing even the Nepalese government is standing up to the big bad India. So this, this kind of a frenzy that comes into people because they want the government to be strong at this point. They want one entity to be strong to protect the people. So there is a need from the people to make the government strong. But is it good for democracy? Is it good for these countries themselves? We are not sure. We are not sure whether this can continue even after the emergency. Can we go back to what it was, or can we have more people's participation? Whether the government will listen to people at that point of time, we are not sure. But at this moment, people do want that strong government. People do want. And in India's case, all of the testing, all of the labs, all of the patient recovery, all of the care for the COVID patients are all happening in government hospitals, government-run labs, government-provided testing kits. So we do not have the private hospitals who are actually looking after the COVID patients. There are instances when the private hospitals have turned away the patients who are tested positive for COVID and sent to government hospitals. And people, because they don't trust these government hospitals, they want to be treated in a private hospital. So maybe the disease is hidden and you do not want to show that you're positive, and you hide your test results, but because you want to get treated in a private hospital and not a government hospital. So these problems or issues that we have, that we had with government institutions, have exacerbated this situation, because there is no trust between the government and the individual, and for providing that particular service, which is healthcare. And it is there. I mean, in India, there are government-run hospitals, there are government-run test agencies, which are prevalent in India, and they, because the trust is not there, the private in the hospitals have to step in, but they're not allowed to, because they don't have the test, they don't have the government permission to test. So this becomes a little difficult here, and this is where when we say government policy making, this is where the policy making becomes important. How do you decide whether you are going to allow the private agencies to test or not test? And this is where the administrative, the strong government, what the government policy can do, that comes into picture here as well.
All right, thank you, Dr. Deshpande. Definitely, I really like how you highlighted trust in the government. I think this is a very important concept in politics, and something that government should really look into, especially during a crisis when we're just flooded with uncertainty, not only us, but also our government officials. So the questions are rolling in. So I'm going to fast forward to our last question so that we could have a little bit more audience interaction. And so I will not be monopolizing the question asking. So I hope that our audience has written their questions as well in our chat function of the platform of our Q&A. I know that we already have received 3. And I would like to apologize ahead of time if we are not be able to answer all the questions being asked due to the lack of time. So the last question is, since this is, after all, a discussion hosted by an international association for political science students and young researchers, I think that it's fitting that we ask the question, what the role is of the young generation, especially of students of politics, in dealing with academic, or in trying to somehow smoothen the blow that we are currently experiencing now. So for our experts who are professors, mentors, role models of a younger generation, what do you think should the role of the younger generation be as a way forward, specifically us students of politics or researchers of politics, or people who are studying, reading, writing, talking about global politics or even regional politics? And for a junior scholar, Ms. Se, how do you envision your role as a student in politics in moving forward, particularly as a student who studied in Wuhan University and has somehow first-hand account of what has been happening in the pandemic in China? So I think we can start with Dr. Deshpande. Please, the floor is yours.
Okay. This is, one of those historical moments that comes in one's lifetime, wherein your whole idea of how you're going to go forward changes completely, because there are new opportunities that are coming into you. There are new avenues that are opening up, but at the same time, you're worried that maybe whatever you have done before has not prepared you for what is going to come forward. But I would say this is an opportunity. This is, this is an opportunity for all the students of politics to enter into actual policy making. I mean, I know there are, I'm not saying only policy making is the answer for this, but there is, as students of politics, you have seen what has worked. You have seen what emergencies can do for your country, for the population around you, for the global politics. How do current countries behave during emergencies? You have seen, you have been observers of that happening currently. That gives you a perspective which nobody else had before. And that gives you a lot of scope to get into the research area for especially policy making, for dealing with emergencies, for even otherwise, if not this pandemic, then we have other problems in the world that may come up at any moment of time. So how do you prepare yourself for climate emergencies, for a disaster that is waiting to happen? How do you prepare yourself for something like that? It may not be exactly like a pandemic, but it is something that you can prepare yourself for. So what do you put in place if there is something of that problem that comes up here? The disaster relief or climate disaster that can come in. We can also go into research about people's behavior during emergencies. There is so many avenues for research at this point of time. I mean, even for a political science student, we're not doing even any other medical emergency, we're not doing any other vaccine making, but we have a lot of opportunity for research into human behavior. How do we already talked about civil society. How do civil societies behave? How do governments behave during emergencies? How do people come together during emergencies? What happens to the government structure? Which are the changes that come into government structures? Because again, we haven't seen those. We can even look back into, there was a discussion that we had in our university when somebody pointed out that, the greeting that, what we used to have, the shaking of hand, or even the namaste that we have in India, how that changed even during the time of the plague, the fact that the plague and the Spanish flu, those period timings that it has changed. The behavior of the humans has changed according to how we have faced the different emergencies and disasters. These are avenues for research for students to get into, which are really interesting and can bring up a lot of changes in the way we look at what has happened and how we prepare ourselves for it. And there are various avenues to get into the government or to help the civil society or to even help the businesses look into the disaster plan. Companies are coming up every single day in how do you help people? How do you change the way you look at supply chain, or how do you manage globalization at this time of the time when you can't really travel anywhere? There are new things that are coming up every day. So I don't think any student of political science will have any problem in getting into these avenues. So I would say this is a great opportunity for study into human security, study into disaster relief, climate change, all those that we had neglected because of power politics. We can come back to all of those now, and the non-traditional security threats that we had not completely ignored before are now coming into the picture. We can look into those areas for research and getting involved in the civil society. Yeah.
Perfect. Thank you so much, Dr. Deshpande. The questions are really rolling in. So I'd like to ask Dr. Bokhari and Ms. Seth to just give somehow like a quick answer on the question, so we could finally give the floor to the audience.
So very quickly, look, young people, young scholars, budding, aspiring political scientists need to go beyond sort of the conventional means of research, and they need to arm and equip themselves with, the best possible skill set, tradecraft of analysis. It's no secret that academia tends to be very theoretical, and by its very nature, there's a huge emphasis, from my point of view, if you ask me personally, I have a PhD in political science, but I can openly admit that what I've learned beyond academia in my professional life, it was just completely far more empowering in terms of my ability to understand how the world works. So, for example, conventional political science degrees and international relations degrees or comparative politics or political economy, all of that training is great. You need it, but it's not sufficient. It's necessary, but it's not sufficient, because that's sort of just the sort of, as they say, the beginning of wisdom. And so what you really need to do is to look at, practice. How does this politics play itself out in practical terms? So international relations theories are great to ground you, but you need to go beyond them and say, okay, how do I achieve that tradecraft so I can better understand policy making and then the politics of surrounding policy making. What is the bargaining? What is the give and take? How do actors react? I mean, there is a conflation of between what ought to be and what is and what will likely happen. So I think that needs to be disentangled, and I would really encourage young scholars to look into the discipline of, and these are emerging disciplines within academia itself, but there's, I call it tradecraft. So intelligence studies, geopolitical studies, empathetic analysis. These are things that are not unfortunately taught or provided as part of the regular training that we have in universities. Obviously, it's different from different places. Europe is somewhat different than Asia, and then North America is completely different than both. But nonetheless, I think there is value in learning tradecraft and reading as much as possible and coming up with innovative ways of trying to understand how does this world work, how do political actors conflict with one another, and how do they negotiate, and how does policy, actually is formed. And sometimes, it's not actually, sometimes, more often than not, you will realize that the political actors themselves don't know what they're going to do until it's upon them. And I mentioned earlier, COVID-19 is a perfect example. Nobody knew, but it doesn't take a pandemic or an unprecedented event to demonstrate that. Every day, political actors of different types are dealing with situations. So we need to understand their constraints, their imperatives, and therefore there's a need to go beyond conventional political science.
All right, thank you, Dr. Bokhari. And last but definitely not the least, our young scholar for this session, Ms. Se. How do you envision your role as a student in politics, especially in China, and moving forward?
Hi, everyone. Regarding to that question, I think that most of the Chinese political science students, they would like to learn more knowledge about economic, philosophy, and social science. And they think other major knowledge can broaden their eyes, and they can concern more about the social issues from different views, from different perspectives. And I think that is what the Chinese students want to do. Yeah.
Perfect. I feel like there is some sort of an agreement with our three panelists, if I could call you that, in sort of thinking outside the box and keep on thinking, keep on studying, and keep on doing politics, I think, and studying politics. Perfect. So now we do have a couple of minutes left, and we are moving forward to the more interactive portion of our e-discussion. I have received a couple of questions here for our experts. And the first question is from Lincoln. And he would like to ask Professor Bokhari about his views on how the pandemic will change the Sino-US relationship. Our second question, if I could, I would just say all the questions here and provide time for our experts to answer. The second question is for Dr. Deshpande by Solis. Scientists have been warning us of hidden diseases within ice caps that could resurface due to climate change post-COVID-19. Would the participation and concern over coming to solutions for climate change internationally get accelerated because of the threats of another pandemic? That is quite a scientific one. We have a second question for Dr. Bokhari. If I may, I'm just going to be asking two questions each expert. The second question is, the notion of global public opinion is that the virus started from China. How is this perception likely to affect the relationship of China and its neighbors like India, South Korea, Philippines, Vietnam, Japan, especially as their traditional relations have not been that good? And lastly, I think that we could direct this question to Dr. Deshpande. After post-COVID-19, can we anticipate a new Cold War between the US and China, or China seeking hegemony, filling up the vacuum in the international order? How do you look into this matter? So I think that our experts do have quite a handful here. I think we could start with Dr. Bokhari. The first question was again about the relationship between China and the US. And the second question was on the notion of public opinion, global public opinion that the virus came from China.
So on the first question, there is no good one answer, because Sino-US relations, US-China relations are very complicated. There are multiple facets to it. So I think that and then we have to look at what will happen in the United States come November with the election. Is President Trump going to get reelected? And then that will sort of lead to, one potential pathway of outcomes. And then if Vice President Joe Biden wins, then we're going to have a different sort of attitude from Washington towards Beijing. Now that said, and it's unclear what that will happen. But if you drop below the level of politics and the electoral cycle, there are certain things that are, there are, well, if you will, defined, and they're not going to change. And those have to do with the fact that the United States is reacting to China's, flexing of muscles on multiple spheres, BRI, in the physical space, Chinese information operations in terms of, cyberspace, growing Chinese military capabilities, and so on and so forth. So that is the backdrop that cannot sort of be dismissed or set aside because of COVID. COVID will reshape that backdrop, but that backdrop will continue to be there, and it will determine how both sides deal with each other in an era of COVID. So I think that the United States is going to try and leverage, it's already doing that, the origins of the coronavirus being from Wuhan, from China, and apply pressure on Beijing to basically extract the concessions that it needs from President Xi's government. And so I think that the issue here is this is an opportunity for the United States to try and push back on China. Whether it's successful, to what degree, that remains to be seen, because as I said, this is a very complicated relationship. It's not zero sum at all. And there are constraints on the Americans, there are constraints on the Chinese, and we'll just have to see how that plays out. But definitely, I think COVID-19 has produced a situation. I do want to mention that regardless of whether President Trump gets reelected or not, I think that there is an American sort of shift in sort of national attitudes towards internationalism. The internationalism that existed from 1945 until, I would say, the end of the Obama era. And that, I think, is fading, not because political parties want to do that or because President Trump is pushing it. It's a national appetite. There are circumstances inside the United States that are pushing and it doesn't matter which government, are placing pressure on Washington to look more at home and not have to invest so much overseas. So a disengagement from foreign policy. So what I'm saying is the rise of nationalism as opposed to internationalism isn't a Trump phenomenon. President Trump has picked up the ball on this and run with it. He's currently represents that, but I think this is a long-term trend, and it'll be around for several years. So that will shape how the United States deals with not just China, but also Russia and other great powers. What was the second question? It was also related to U.S.-Chinese relations.
It's more on the relationship of China with its neighbors like India, South Korea, Philippines, Vietnam, and this global public opinion that the virus started from China. Will this global public opinion affect China's relationship with what the persons seem to assume is already a strained relationship with these countries?
Yes, I think that again, just like I mentioned, that the origins of this COVID-19 being from China doesn't just affect the United States; it affects those neighbors as well, India, Vietnam, and from the U.S. point of view, China is too far. Geography matters, but these countries are like right there. India is next door to China. So is Vietnam and these other countries. And they're always worried about Chinese hegemony. And they're aligning themselves with the United States in order to sort of, prepare themselves for a far more aggressive, if you will, China, not necessarily militarily, but just geopolitically in general in the years to come. And how do you manage China? How do you balance the pressures coming from China by aligning yourself with the United States? And that gets complicated because the United States, as I mentioned, internationalism as sort of a doctrine, guiding doctrine for foreign policy and international relations from the American point of view is fading for the moment. I'm not saying it's completely going, but at this moment that's not sort of the priority. And if you look back to the Obama era, it was the Obama administration that was withdrawing itself and trying to sort of reset and pivot to Asia and figure out how that's going to happen. So these countries will have to figure themselves out. And I think that they will also use this as a bargaining chip in the way they deal with Beijing. And we're also already seeing, and I don't claim to know fully what's happening between India and China with this sort of border thing that's going on, this time not in the north east, but in the northwest, in Kashmir. There have been all sorts of reports about the Chinese military building on the Indian side across from the line of actual control on the Indian side, and the Indians reacting. And so we're already seeing, and this is taking place amid COVID-19. I'm not sure if this is something that was in the already in play before COVID-19, or is it something that started afterwards? Like I said, I don't have too much information on it, but you can see some dynamic taking place there, and the Indians reacting. And quite frankly, right now, none of China's neighbors know, what is the status of China right now? How badly has China been weakened by the pandemic? Are things back under normal control? Yes, the deaths have declined. We're not getting reports, but then again, information isn't reliable either. So in this game of information warfare, there's senses of vulnerability that we have to factor in when countries like Vietnam and others will deal with China, especially if you're Japan or South Korea and Taiwan. So, and then of course there's the Hong Kong factor as well. What is going to be the status? And we saw Secretary of State Pompeo issue a statement on that, saying, hey, the United States is now looking at Hong Kong in a very different way. So I think every regional player is looking at China bilaterally, and they're also looking at China through the prism of the US, saying, okay, so what is the US position on China and how do we adjust? I hope that answers your question.
Right. I hope so too. And now the two last questions for Dr. Deshpande. The first one, if I may paraphrase, is Considering how the scientists have been warning us about hidden diseases within the ice cap that could resurface due to climate change, would this particular concern accelerate the solutions that the global community would be taking in rather solving another threat or a possible other pandemic? So I think this is more on a global decision making on whether COVID would set a precedent and actually the global community preparing for a different kind of pandemic or disaster, if I could use the word. And the second one is, can we anticipate a new Cold War between the US and China, a little bit controversial, or China seeking hegemony, filling up the vacuum in the international order? How do you look into this matter?
I think I'll answer the second question because it's building on to what Dr. Bokhari already mentioned. Yeah. Yes, there has been movement of Chinese troops which have had concern for India and Southeast Asian countries because of its movement in South China Sea and how US reacted to this. And this is not something, as Dr. Bokhari mentioned, it's not something that happened during COVID. It's been there, it's been happening, but what has changed in China is, I think, about, again, some of the reports that I have read, is that Xi Jinping now needs to get back that trust from the Chinese and the surrounding areas back into China. And Chinese government machinery, I'm sure the scholar from China can also answer this, the Chinese government machinery has been working over time in improving China's image abroad. And how do you do that? Is through public opinion. And so China has been helping all the countries, supplying masks and ventilators and medical supplies. They're supplying it to other countries to repair that image that they have had. And they're also increasing the troop movements to show to the other countries or the border areas that they have not lost anything that they've had before, that they are as strong as they were before. And again, this was a report that said that Xi Jinping is trying to do it both for the international audience and for the national audience to show that China is as it was before the pandemic hit China, and they are still as strong as they were before. So I don't know about the war. I don't think there will be a war between India and China, because China may be able to afford a war with India, but I don't think India can afford a war with China. So Indian government has been saying that we are talking to China in multiple platforms. We have not stopped talking to China. We are dealing with China in whatever situation that has come up. We are talking to China. They never said we have stopped talking. They never said we are threatened that we are going to take action against China. None of that rhetoric has come up. The rhetoric that comes up is, yes, we are dealing with China. And it's not a war-like situation, but we are talking to China. So I don't think there's a threat of India-China war from the Indian side, but I can't speak for the Chinese. I don't know what Xi Jinping plans to do, but I don't think it is going to be a war. It's just as long as we know that, as long as China knows that everybody knows they're strong enough, and they're still being considered as somebody who will replace United States, if at all, in the world hegemonic powers, and that they are considered much more powerful than the United States, I think they're going to be happy. And that's what they're trying to establish around Southeast Asia and in Asian countries, to show that they are more powerful and that United States is a waning power. They're not as strong as they were before. So yes, China can replace them. And that, again, even Russia is helping China. This is, again, reports that I've read. Russia is also helping China build that image. So both of them together are supplying medical, wherever what United States used to do before, China and Russia are stepping into those. So the vacuum left by United States is being replaced by Russia, China, and even India for that matter. Even India wants to get into that vacuum area and show that the region that they are powerful. The SAARC summit that Modi had with all the SAARC countries wanted to establish that we are strong. Pakistan refused to come to that meeting, but they want to show that regionally they are able to help other countries. So everybody is positioning themselves to show that they can take that vacuum, they can come into that vacuum. And this is, again, very temporarily. I don't think it can go on after the emergency, because everybody comes back to that kind of a developmental mode, and nobody can go on the same way. But for the time being, that is what it looks like, that everybody is positioning themselves. The second question about climate change and what may come out of the ice caps. The problem is, I mean, not everybody is sold on the idea that ice caps are going to melt and all the pandemics are going to come out. What everybody is worried about is the sea, the sea level rising, and most of the flooding happening around the country, and the climate itself changing over time. So there is famine, or there is the flood and the famine and all of those kind of disasters that can displace people. That is what worries more people than just the regular melting of the ice cap and what comes out of that. So yes, many people, we will be prepared more for disaster management than about the pandemic, because this happened even after the 1998 tsunami, 99 tsunami that we had, a huge tsunami. Every country in the Indian Ocean region started preparing for disaster management. And disaster management and disaster has become the buzzword even in the academic circles in India, because they want to be prepared for something of that sort. And so, even now, this pandemic is going to get everybody prepared for that health pandemic and for disaster management, not about what will come out of climate change and that kind of a pandemic. We will be prepared for the next pandemic, but not because of climate change, but just in general, more infectious diseases that may come up.
Thank you. I know that we are absolutely running out of time, but then I simply cannot say no to our IF's Asia Chair's question. Rutaba Tariq has worked so hard to make this event happen. So I hope that you could give us at least 5 more minutes of your time. Would that be okay?
I'm fine with it.
Sure.
Okay. Her question is, to what extent, and I think we're definitely going to be ending it here, just very short, quick statements from you two, who has been very wonderful. To what extent would the pandemic assisting the rise or existing authoritarian regimes in general around the world, but also in Asia? Considering that we are consciously putting human rights at the back foot with more civilian tracking, monitoring, and unchecking policy brutalities, among other things, being practiced. So to what extent do you think the pandemic is assisting the rising and existing authoritarian regimes? Maybe Dr. Bokhari would like to start.
Yes, of course. Look, there are two sides to this question. One has to do with what I've already mentioned, that all actors are now reassessing, recalculating because of the pandemic, the way they operate. And a lot of them, if not every one of them, to varying degrees, is under pressure. And this goes for all governments of the world. Now let's switch to the ones that are authoritarian. Authoritarian governments tend to disproportionately be weaker from an economic, financial standpoint. So we have to factor in that they're being constrained. So there is that aspect to it. That they are under more pressure than they were before. But at the same time, the reaction, the global reaction to the pandemic of locking things down, of keeping people, like enforcing shelter in place, and the disruption of sort of what we would call normal civil society life, that provides them with an opportunity to enhance their control. Because right now, think of it, if you have, what is the biggest threat to authoritarian regimes? Is a vibrant civil society where people are interacting, socializing, mobilizing, and then coming together to put forth their demands on the government for greater freedoms or whatever their cause is. If people cannot mobilize, if they cannot socialize, that's good for authoritarian regimes, and they would like to be able to use this situation to tighten things that may have slipped, or sort of fill in those cracks that have come about over the years, where this is a moving target where you have governments trying to oppress, free speech and other forms of freedoms within society, but then society also pushes back. And so this is a give and take. It's a tug of war. This is not static. This is a very dynamic situation. So I think that COVID-19 allows for at least a reprieve for authoritarian governments that have been facing pressure. And for those that were not facing so much pressure, this sort of helps them put things further in under their control, because you do need to lock down. Who's going to lock down is going to be the government, not people. And so I think that there is definitely, it's a mixed bag, but it does allow for, if I had to make a net strategic assessment, I would say that authoritarian regimes, while financially they're going to be struggling economically, but politically speaking, from a control point of view, they walk away on more firmer ground. Depending on who they are, every case is different.
Thank you, Dr. Bokhari. Dr. Deshpande. You are muted again.
Got it. Yes, thank you. I got it. So I'm looking at the question as in, yes, authoritarian. I just want to again add on to what Dr. Bokhari said. What the question mentions is, considering that we are consciously putting human rights at the back foot with more civilian tracking, monitoring, unchecked police brutality. Yes, I mean, the Asian countries are not known to have put humanitarian concerns of the people, in the front always. I mean, we are always thinking twice before we think about human rights. And all of these, the tracking, monitoring, and police brutality has come up now, and the police have more authority to show to the people that, it's a lockdown. You cannot step out, so you cannot step out. And then the technological improvement in monitoring, which has come up in the gaze or in the guise of tracking for the COVID disease. I mean, there are various apps that all the governments have come up with. I mean, starting from South Korea, China, India, and even Pakistan, which I recently read, has again put in a tracking device that can be used for making sure that the patients are not going beyond what they are supposed to be there, or there is the containment area where they're not supposed to get out of. So these tracking units are a concern, because when do we say that the pandemic has ended and do we now stop tracking people? But if you already have that capacity, can you use it for something else already without even taking people's permission? Yes, we've had this problem, so we are now going to continue this. And we've seen that happening in China. We've seen that happening in other authoritarian regimes where once you start tracking, you don't know when they will finish at all. It will continue to happen. So that is a threat, definite threat, even in countries which are not known to really put in human rights in the front foot. I mean, especially in India, is we may all download that app that we are using to make sure that we are not in the containment area. But when do we know that that has stopped tracking people? We don't know whether it has stopped tracking people, because we have given that authority to the government now. Do we need to really worry about that same coming back to haunt us later on? And that's a worry that, I mean, I think it's a valid worry that everybody can, it is possible for the tracking to continue, but do we give that authority to the government infinitely? Or do we put restrictions and say, okay, at this point of time, you have to end this tracking, you have to end this collection of information? Can we put that in at all? I mean, this is again the public participation that needs to come in. And how much of an authority do you give? This is emergency situation. Will we limit it to this, or will we go beyond it? Again, it's a very conscious citizenship that needs to come through. And if people are, I mean, if we are not aware, and again, political science students can help here, that, if we are not creating that awareness, I think we will have a lot more authoritarian governments that will continue to be in place even after the pandemic is gone.
Thank you so much, Dr. Deshpande. As somebody who grew up in the Philippines and as a Filipino, police brutality is one of the biggest problems that we are facing in our country. So So now we have reached the end of our e-discussion today. Thank you so much for our audience and for the IEPS Asia team, and most especially for our experts for spending a little bit more than an hour and 30 minutes with us. Again, I completely apologize, and I would like to thank Ms. Sia for providing valuable insights. As a student of politics in China, particularly in Wuhan, quite an interesting summary of what has happened there. And I would also like to thank, of course, our wonderful experts, Dr. Bokhari and Dr. Deshpande, for being with us today. I personally, it was an absolute pleasure to have you and to talk to you and to hear your thoughts about this. Definitely refreshing after being alone in my flat by myself. And I would also like to thank IPSA, again, the International Political Science Association, for supporting us and for sharing this event. I would like to ask everyone to give a big virtual round of applause to the IEPS Asia Regional Leadership Committee, in particular to our IEPS Asia Chair, Ruta Batarik, and to our IEPS Asia Projects and Events Coordinator, Ganesha Diwani, who led the team in making this possible. They only asked me to join as a moderator. So all the work has been done by this amazing IEPS Asia regional team. And I would like to ask our audience to please fill out the feedback form, which is linked in the chat function of our platform. The link will also be sent via email, and your feedback would be extremely valuable for the team, because this is our first event and our first online event in the IEPS Asia. I would also like to thank our amazing audience for joining us today, and we hope to see you in the next e-discussion. They will be on political participation of students in Asia, as well as on diversity in Asia. Have a pleasant morning, day, and evening. Thank you so much, and see you soon.